Okay, so today we're looking at behavioral science for medical students, which is one of the most important courses because of how impactful it is in clinical setting. And don't just focus on the anatomy, the physiology, and neglect behavioral science. Today, we look at what is behavioral science. Now, we define behavioral science as a set of social sciences, i.e. the economics, anthropology, sociology, philosophy, psychology, among others, that help us to understand the individual as a complete person. Now, the individual here as a complete person, we would have to dive deeper. Now, for medical students or as clinicians in training, the individual that we are talking about is the patient, those who come to us in the hospital. So the patient, okay, yes. And these people, we have to understand them as a complete person. How do we understand them as complete persons? Now, don't forget that those people that come to our consulting rooms do not only come with, what do we call it, a biological haywire. They don't only come with their physiology gone bad or their physiology gone wrong. They also come with an environmental compass, a circumference of their society, okay? And being able to understand their circumference, their environmental surroundings, help you to make substantial diagnosis. Okay, and so that is what we have here. So that is what this course aims at, to help us understand and appreciate the individual as a complete person, to be able to make substantial diagnosis and also to tailor our prescriptions to benefit everyone. So that is the reason for studying this course in medical school. First, or in the past, from the time of Renaissance, even to the dawn of the 1900s, okay, yes, we realized that medicine was going through what we call the mechanistic biological status. So all that we were looking at was what is wrong with the biology, what is wrong with the physiology, what is wrong with the anatomy of the person, without actually considering the environment or the environmental circumference of the person. But currently, clinicians take an eclectic outlook, which is a Catholic outlook or a universal outlook at the biopsychosocial circumference of the patient. And so we don't only look at the biology, we look at the psycho, which is we look at mentally what is happening, the trauma that the person is going through. And then we look at the social circumference. We try to understand that to be able to give informed and sound advices and then even make sound diagnosis. Okay, and that is what helps us to understand the individual as a person, as boldly written here. Sorry. Another thing is that we also would like to look at the impacts of behavioral science. This is behavioral science. Now, behavioral science has improved healthcare because we are able to tailor prescriptions after understanding the patient's environment. And there are some factors that we look at, which is your geography, your age, your occupation, or your economics. If somebody comes to your hospital and is saying that he's having insomnia, he can't sleep, you don't just look at, well, you are having insomnia, so just take this drug, this drug, this drug, and then it will help you sleep. No, you are able to understand the age of the person. Maybe the person is 80 years, and you know that senescence also has a role to play even in insomnia, in sleep. Okay, maybe you don't have to look at the occupation. Maybe the person is a security man who usually works at night, all night, and so is not able to sleep at the time that he feels like he can't work again, and so deserves sleep. You see, yes, because there has been change of the circadian rhythm. Another thing is when you have people who come to your hospital and you have a rich man and then a poor man, quote unquote, who come to your hospital for treatment. You don't just give them the same drug, which they all have to purchase at the same price. What you do is you provide drugs with different forms of efficacy, yet would heal, so that each of them can afford and can work on the drug, can purchase the drug, and then use it. Or else, if you tailor, or if you just give them any drug at all, the poor man may be tempted to die because the drug is too expensive. You understand? And so that is the very reason why we look at behavioral science. And as said, it has improved healthcare because we are able to tailor prescription. We are able to tailor prescription. So that is the very reason why this course is so important to us in medical school. We'll take time and look at different bits of this course. So keep up, subscribe to our channel, hit the notification button, and then wait for more. Thank you very much. Bye.